Welcome, health enthusiasts. You're tuned into Health Unabashed on Healthcare Now Radio, your one-stop shop for all things health, wellness, and innovation. We are here to shake up the status quo in health, making it sustainable, equitable, and oh-so patient-centric. I'm Greg Masters, your co-host and executive producer, and I'm joined by the digital health aficionado himself, author, global thought leader, and, might I add, in his executive role, steward servant, Gil Bash. Together, we're on a mission to bring you the people, ideas, and the companies that are not just talking the talk, but walking the walk. On today's menu, Gil chats with surgeon, digital health pioneer, Rafael J. Grossman, MD, a fellow in the American College of Surgeons, whose website notes, quote, "The exponential development of technology and its smart use will profoundly, positively impact the healthcare system in ways that are difficult to even imagine," end quote. So with no further delay, Gil, the mic is yours.
Greg, I want to thank you very, very much. This is a guest, a very special guest, Dr. Rafael Grossman, who is a dear friend to both of us. Obviously, anybody who is following the practical nature of innovation technology should be following Dr. Rafael Grossman. Outstanding surgeon, actually with multiple degrees from around the United States. I even think you spent some time consulting Rafael in the engineering department, probably of Sloan or MIT, one of those great schools. Great background. Dr. Rafael Grossman is an outstanding surgeon who understands that it's not just his intellect, his curiosity, his tactile skill to sustain and save patients' lives that's really brought to the table. It's actually also the surgeon's imagination, the ability to harness technologies, different types of technologies, in order to essentially bring the full weight of skill and knowledge to the surgery table so that people's lives can be better. Rafael, you told me a great story. Oh, I think it was maybe last year or much earlier this year, that when you were really the first surgeon to use Google Glass in the OR, the hospital administration was a little bit taken aback, to say the least. And they were probably saying, wow, why is he doing that? Is that a liability? And you obviously showed them, on the contrary, it's improving patient care. I'd be curious, could you go back to that time? I know you're cutting edge on so many different technologies today. That's like an old story, but I'd love to hear it.
Sure. Well, thank you, Gil and Greg, for the opportunity. And it's really great to be here, at least virtually, with both of you. When I did that operation, it was really out of the interest to make my teaching and my students' learning better than it was, using technologies that were not really created for that. Google Glass at the time just tried to stream my point of view of an operation, so the students would be comfortably sitting nearby, but not in the same space. Relaxed and able to answer and ask better questions, better answers, and with the perspective of the surgeon, because of the design of the Google Glass, which I still think it was brilliant. So when I first had the opportunity to hear from the inventor of Google Glass, Babak Parvis, back at the Ames campus of the former Exponential Medicine, Next Med Health, my good friends, Daniel Kraft's, our good friend Daniel Kraft's enterprise in a way. So I said, I have to use this device to show better the way we operate and to guide my students better. So I decided to do it pretty quickly after I got the device, which was also pretty rapidly after I invoked Babak Parvis's interest. And I wanted to be not just the first one to do it, but the first one to impulse this movement of using technology in a smart way to improve how we connect and how we communicate. And in this case, Google Glass, which was something that was mostly advertised for taking pictures of your cat or your point of view, jumping from a plane or music, that kind of stuff. And it really made a big difference, I think, in many aspects of my life for sure. Next day I was just getting calls from all over the world, really, to talk about this, and in a way catapulted my career in digital health, which had been there before to some degree, because we started doing telemedicine with iPod Touch devices. That was my first TED Talk back in 2011, 2 or 3 years before this operation. But in a way, people just couldn't believe this was done. And it was really simple and not really planned.
I've always been curious. Many years ago, I would go down with cardiothoracic surgeons down to the basement as they practice on Da Vinci. And I'm sure that you were masterful on Da Vinci. For our listeners who are not familiar, it's not an architect or art form. Actually, it was and still is sort of a large sort of sit-down machine where the surgeon can actually practice or rehearse the surgery that they're about to undertake, just to go through trial runs and perfect it like any great professional would, like a football player would. They go out to the field and practice, and then it's game day. Same with the surgeon. Their surgeons, in a way, are great athletes trying to save and sustain and improve people's lives. They use technology to do that. And I was always curious because we tend to think of technology as something out there for the future. We don't realize that as a surgeon in the OR, you're about to apply it tomorrow morning. You're looking at various technologies. And for a lot of us, when we're talking about the future of augmented intelligence, or we're talking about different ideas, wearables, and so forth, there's a hopeful aspect to all those technologies. In your life, it's a realistic view of those technologies. Do you mind sharing with us a little bit in terms of the weight, the amount of technology that you're using beyond the scalpel that's become commonplace in your OR?
Sure. I think, technology is always there, always expanding and exponentially expanding and improving, I think, in most ways. And a lot of technologies are not really created for healthcare. And I think that a lot of the technologies, almost all of them, can be applied to some degree of healthcare, from education to diagnostics to treatment to rehabilitation. And in my particular case, for the last few years, extended reality, right? The combination of virtual, augmented, and mixed reality has been in my radar very, very intensely over the last few years, along with, at least in the last couple of years, for sure, the generative AI, the large language models, all of that combined, along with haptics, to me, form the perfect equation as a surgeon, to improve how we learn, how we practice, how we diagnose, how we treat. I think those three technologies are just the perfect mix to allow us to almost have no ties to the physical world, no geographic or even time barriers sometimes. I think that the amount of devices out there that are just XR or just generative AI or just haptics is phenomenal. And combining some of them, and some of them already combine the three ecosystems in a way, in ways that are fascinating and very helpful, I think, for surgeon.
There's some great photographs of you on your website. I encourage all our listeners to jump over to Rafael's website, because it's not like a website of any doctor you would have ever seen before. It's really, you almost feel like you're entering the land of Oz and being introduced directly to the wizard. And first of all, I just want to circle back on something you just said that I think was really a shift, because when we see VR, we automatically think of virtual reality. And you use the term XR, extended reality. And the virtual reality means it's almost divorced or separated from us, our sensory system, our minds. Extended reality is almost creating the infinite possibility. It's like the health professional or the person entering into the world of a bit the matrix, They are really connected to that world beyond very directly. There's a direct link. So when you think of extended reality, are you kind of signaling to us, I'm extending the space of which I'm, no pun intended, operating in. My ability to think and see and act goes far beyond what my eyes can see and my hands can touch. Could you talk a little bit about that XR element of your life?
Yeah, I think extended reality is a great term, right? It's as you know, it's a term that is used to combine what virtual reality, augmented reality, and mixed reality are in one big umbrella. But at the same time, the name is exceptionally good because, as you said, in a way, it expands your horizon, your reality to be more than what we can feel, hear, touch. I think that the extended reality ecosystem involves a lot of different dimensions, if you think about it, to allow us to almost be, I hate to say godlike, but allows us to have almost no limits to what we can do, right?
I thought you were going to say Daniel Kraft-like, but God-like too. You're connected to Daniel in a way. You were exposed to Google Glass with Daniel, and I'm not surprised, by the way, it was in his sphere that this happened, because his mind machine is working nonstop on the what ifs and how do I, down to the fact that he's flown in F-16s as a flight surgeon. He's a surgeon. He's doing, exponential university. He's doing 1,001 things. I just saw him last week. We were at Health together. He flew his own plane from California to Las Vegas.
Yeah.
He's a person of incredible possibility, incredible possibility, as you are. I'm wondering, does the circle you hang out in, does that influence your perspective about where you're going to go with technology? In other words, I sort of believe that when you hang out with really smart people, you get smarter. If you hang out with dweebs, then guess what? You're going to be dweeb-like. So do you kind of focus on who you want to hang around when you go to meetings?
Well, Gil, thank you for those words. I don't feel that I'm smarter than anyone else. I do feel that the connections we make obviously make a difference for the good or for the bad. And I, over the years, have been blessed to get to meet and then get to know and interact with many people, a number of people, you included, Greg included, Dan Kraft included, and many others who really have shaped my way of thinking, my way of being in a way. I think that is important, especially for the younger generations, people who's, I get the question, hey, well, how do you do that? What you do? How do you get there? Well, I think it's all about being in the right place at the right time, but it's not just a matter of fate or luck. It's very much something active that you have to say, okay, I'm gonna, let's say you go to Health, right? And it's a mega meeting with thousands and thousands of people where you can waste 3 days of your life, or you can make it very, very useful by trying to, in a good way, target the right people, to hear them, to see what they're saying, to try to in a way impregnate yourself with the passion that they have for how to improve, in this particular case, right? How to improve healthcare, how to make it better, how to teach and learn better, and at the end have better outcomes and have a better provider and patient experience, and better, most efficient, more efficient healthcare, but better cost and less errors. All those things are really something that one has to actively seek. And I've been just lucky, really, to be in the right place at the right time. But it just takes, like my godfather always used to say, God is a product of hard work, and I think
I'm just thinking of this whole thing of, like, you sort of suggest that it's luck, and I'll counter and say, to some extent, there's sort of divine providence, and some extent we make our own luck. You put yourself up there. You decide that you're going to wear a Google Glass in an OR. And you decide to take a smart, calculated risk to push the envelope forward. And I want to go to the other side of the equation for a few moments. To the best of my knowledge, people go to medical school and they don't really have a semester-long course for 2 hours in medical school that deals with the application of technologies that are popularly used. They don't have a course specific to extended or virtual reality. They don't have a course or a section of a course embedded on remote patient monitoring. They don't have a course on electronic medical records. All of these technologies that you find as extensions of you, they have to go out into the world. They get their MD. They're shoved out the door toward their residency, and they have to be exposed. Some are eager to push the envelope or to learn. Some are, leave me alone. No, I'm just going to do this. Your life, I mean, the essence of who you are is sort of saying, no, you think I'm exceptional. You are, but you think I'm exceptional. I'm actually just the model of, in your discipline, of where you need to go. If you're not using augmented AI, if you're not aggregated AI, if you're not doing this, if you're not doing that, you're not really living up to your base potential as a physician. And looking back at who you are and where they're coming from. And we've often together, you and I have talked about upskilling physicians, the need for them to get at least intellectually savvy about technology. Do you think medical schools today are saying, gee, we're teaching them a lot about physiology and biology and organic chemistry. We're teaching them about memorizing countless body parts. We're teaching them about base medicine, observing. Maybe we need to invest significantly in their training around technology. Is that a gap in the physician's sort of training?
Just dropping in, you're right on time for Health Unabashed on Healthcare Now Radio. Today we're chatting with surgeon, educator, speaker, patient advocate, healthcare futurist, and digital health pioneer, Rafael J. Grossman, MD, a fellow in the American College of Surgeons. Stay tuned for the rest of the story.
Yes, the quick and right answer, I think, to this is yes. We are in a very big perfect storm, I call it, to where as the deficit of providers and the demand for providers, populations living longer, getting older, it's unsurmountable, unacceptable, unsustainable. Not just the cost, but the actual practical resources that we have, the human resources, are just extinguishing very, very quickly. And you've heard the numbers, 125,000 physicians in just 10 years, or whatever the number is. Okay, it's something that is we will not be able to cope with this. And at the same time, we realize that the fields that incorporate new technologies in different ways to augment and enhance what we do as physicians, communicate, connect, learn, teach, all those things are not being given the right importance. To a degree, there have been some changes. You see what's happening at the Digital Center of Excellence for Digital Health and the FDA in the U.S. You think that other projects in Europe. Recently, the news about University of Texas at San Antonio started a dual medical school program, an MD program, along with AI. With an AI curriculum, you have programs like my good friend and your friend as well, Brennan Spiegel's at Cedars-Sinai, where they have a master's in health delivery sciences, which I actually did in my old age, that deals with all those uncommonly related to medicine aspects, digital health, analytics, quantitative and qualitative analysis, cost-benefit, cost-effective analysis, the EMR, some policy, all the things that in med school are barely touched, that are so important for a provider. I say a provider with intention, a physician, a PA, or nurse, for a provider to really upskill their game. I think that it is possible to continue to teach medicine the way we're doing it now. You start med school, you do pre-med for years, you do 4 years of med school, and you graduate, in the US at least, physicians that are, I don't want to say incompetent, but really they're not able to perform as the physicians.
They're not fully competent.
Exactly.
Their competency is not really at the level.
Not at the level that is necessary in the 21st century. And then you go to residency for 3 to 7 years, right? If you're lucky, if you match, because remember, the residency positions are very few and the number of graduating physicians are many. I did a TEDx talk about this in May of this year. It's a big problem as well. You graduate, you have this number of physicians that are graduated, real physicians who cannot touch a patient because they don't get into residency. But anyways, and then you go into residency, right, for 3 to 7 years, and then you learn your specialty and you become an anesthesiologist or a family practitioner, or a psychiatrist or a surgeon. And then you have no time to deal with this other aspect in general, right? This other aspect of what medicine should be in the 21st century. And that is a big problem. And that's what we're trying to do. That's what we're trying to preach about, to advocate for. That's why you have people like Shafi Ahmed, my good friend, doing with medical realities, other platforms out there that are trying to inject healthcare with the necessary tools in the 21st century.
Listening to you right now, I'm thinking of the generation of physicians, health professionals who are graduating, and your work. Obviously, it wasn't your decision, but you've become an international celebrity in medicine and technology. That's the reality. I mean, you've been willing to talk about it, to share your information. You're incredibly giving to your patients, but also to your profession. I mean, incredibly giving. Do you find that in applying for residencies, you're kind of bombarded? I'd be just curious to know, people know that you're where you are. Do they have the possibility to check off and say, look, my first preference is like Rafael Grossman's OR. I want to be a surgeon, like get me in there. Do you find that a certain type of medical school grad is applying to you for residency?
Yeah, where I work now, we don't have, unfortunately, a general surgery residency. We have 3 other residencies in other specialties, but maybe in the future we will. But what I do find is that a very specific type of medical student out there. And I do a lot of, not a lot, but I do social media, mainly X, formerly known by Twitter and LinkedIn. I try to have a presence and to give a message, advocating for the use of tech in a smart fashion to improve healthcare.
You do courses, by the way, I see on your website. You do have sessions and courses.
Yes, we do. And but like I was saying, and I'm also an international medical graduate, right? I'm from Venezuela. I went to med school in Venezuela, and I came to the States as a foreign medical grad. So a lot of that population, but also US grads who are looking for something different, who are, I don't want to say geek, but they are looking for the smart use of tech to improve how they learn and how they teach and how they practice healthcare in the next 10 years. And I get a lot of those requests, and I do a lot of mentoring to try to guide those people from how to network and whom to network with, to what resources to tap, or they have ideas, and I just try to, in a way, help them navigate, because it's hard to navigate this ecosystem, I think.
And you're also advising companies. I know you're on strategic advisory boards of many companies around the world, diagnostic, technology, tool-oriented. Anything you can share with us that, you don't have to share a name. Obviously, some of that's proprietary to that company. But anything you can share with us that when you say, I'm advising one company that really excites me, stay tuned, follow me, and you'll figure it out. Anything you want to share?
Well, I think that companies that, as I was saying at the beginning, that align extended reality with a integration of senses, including haptics and generative AI, will really dominate in a way how we do, how we teach, how we learn medicine, specifically. Many other industries as well, but I'm obviously focusing on medicine and healthcare. I think that's the most exciting thing, where you can be in the matrix of sorts, a real player one, a reality where you can be in a different reality, either learning or teaching or doing medicine. Not just with your eyes, with a high definition screen and spatial audio, but also with your senses, touching and feeling the different textures of tissues. I think that is certainly not the present yet, but almost the present, the future very, very imminently. And also, if you include as well the collaboration, I call it collaborating, collaborative XR, because it's XR, but it's not about you. I mean, if you're learning something on your own, but when you learn with others and when you share with others or do with others, you get better, right? And I think that XR, to collaborate and to connect and communicate better, is really where the money is, in a way, pun intended, I guess, for some people. But
no pun intended. I know your dedication to patients. I've got to ask, have you tried out the new Apple headset?
Not yet, not the actual headset. We have had some very good conversations trying to integrate the headset into what we do and what we dream of doing. And Apple, as always, is very receptive. The actual solution that they have people play with, which is, as if you had the headset, you can create anything you want with the solution without having the hardware with you. I think that's really phenomenal.
I've got to say, Apple products, which I adore and adore. Boy, I think they're behind on the switch. I mean, the answer should have been, "Oh, sure, I've been using it all along," and then FOMO would have kicked in, and we would have jumped in. Rafael, this has been just thrilling. What a great conversation. I'm looking forward to continuing this. I'm looking forward to bumping into you, whether it's Health Europe in June or wherever. I hope our paths cross again, not virtually, but in real life. Thank you so much for joining us today.
I hope so, my friend, and thank you and Greg. And we will definitely bump in real density, very soon.
Maybe Daniel Kraft and his plane will bring us together.
Hey, I hope so.
Take care, everybody. Thank you, Rafael.
Have a good one. Okay. Bye-bye.
Bye-bye.
And that, dear listeners, is the last note for today's melody. A huge thank you to our worldwide audience for listening in. And tip of the hat to surgeon, educator, speaker, patient advocate, healthcare futurist, and digital health pioneer, Rafael J. Grossman, MD, a fellow in the American College of Surgeons. For more information or to access on-demand replays of our work, go to www.healthcarenowradio.com and select Health Unabashed from the Programs tab. We stream live 3 times a day, Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern, or 7:30 a.m., 3:30 p.m., and 11:30 p.m. Pacific. To keep tabs on Dr. Grossman's innovative work, follow him on Twitter via @ZGJR and on the web at www.rafaelgrossman, and that's with 2 N's.com. To keep tabs on Dr. Grossman's innovative work, follow him on Twitter via @ZGJR and on the web via www.rafaelgrossman, and that is with 2 N's.com. Stay social with Gil and me on Twitter via @Gil_Bash, and that's BASHE. And Greg Masters, MPH, and that's Greg with 2 G's. And don't forget to give your tweets some zing with our hashtag HealthUnabashed. Until we meet again, pursue your passion for better health and no apologies.